Well, chief medical officers from various hospitals are concerned about a potential surge in COVID-19 cases in the coming weeks and months. And that's because so many people are tired of all of this and maybe abandoning health guidelines like mask wearing or social distancing. KCTV5's Leslie Aguilar is live at KU Hospital. So Leslie, doctors gave you several examples of why we all need to take precautions.
They did, Brad. Right now, there is a woman in her early 50s here at KU Med. Her only pre-existing health condition before catching COVID-19 was hyperthyroidism. She's been on a ventilator for more than 40 days. That's just one example of many doctors gave us today of why we all need to take these health guidelines seriously. In a virtual video conference, chief medical officers from 7 metro hospitals gave a presentation full of facts that show the pandemic is far from over.
COVID is real, and it's real for young people, it's real for old people, it's real for healthy people. It's real.
They say it's true. Most symptomatic people with COVID-19 will recover, but long-lasting effects are already proving to be a problem. Scar tissue in the lungs causing chronic breathing problems, blood clots causing heart attacks or pulmonary embolisms, even cognitive brain dysfunction.
Even those with mild symptoms can develop life-threatening complications from this disease.
People who are not old or sick have died in local hospitals.
We had one person being in their mid-20s and a couple of deaths in their mid-30s.
Doctors gave several specific examples of unlikely cases turning serious right here in Kansas City. A college athlete with no pre-existing conditions, now with significant heart failure. A perfectly healthy man in his 60s who died from a lack of oxygen to his lungs.
We've also had a college student, a young female, who had to have a portion of her lung removed, also changing her life forever. Previously healthy, no reason to anticipate that she would end up there because of comorbid conditions or previous lung disease.
The chief medical officers also stressed that though the flu is serious, this isn't the flu. It's worse.
I know a lot of folks just believe it's not that bad or that they're not going to get it, but it's just not true.
Now we're all tired of wearing masks and missing out on social distance or social gatherings, but doctors stress we can't let that wariness of this pandemic make us let our guard down. They say we need to do all of those health guidelines to ensure hospitals don't get overwhelmed in the very near future. Reporting live, Leslie Aguilar, KCTV5 News.
Yeah, you're right. Can't let our guard down. True said. Thank you. Appreciate it, Leslie.